Welcome to another episode of The Change. I'm really excited to announce our next guest. She graduated from the College of Allied Health Science and Nursing in Kuwait University. She secured her master's in Executive Healthcare Administration from Zayed University. She graduated from Sheikh Mohammed bin Rashid Executive Leadership Program and received the Sheikh Rashid Award for Scientific Outstanding. She was awarded the Feigenbaum Excellence Leadership Award for Women's Leaders. She has been recognized as one of the 50 GCC women leaders. She has been acknowledged as one of the 50 women in healthcare and wellness by CSR and one of the world's greatest women achiever for 2016-2017 by URS Asia 1. But listen to this. She is the former CEO of Health Policy and Strategy of Dubai Health Authority. During her 21 years with DHA, she had led efforts on a series of initiatives such as strategic planning and transformation of Dubai's health sector, health insurance reform, health funding strategy, public health strategy, and many more. She also championed the health authority's efforts on medical tourism to Dubai. Today, she is managing Health Beyond Borders, a bespoke Dubai-based healthcare advisory firm that she founded 8 years ago. I really can't think of a better person to talk about current happenings. And without further ado, it is my pleasure to welcome Dr. Laila Al Jassmi to this episode of The Change Vlog. Dr. Laila, thank you for joining me.
Thank you so much, Vuk. It's an honor to be with you.
Thank you. I mean, I don't think there is a lot of need for the introduction to where we are today, and I don't think that anyone was really ready for the whole COVID-19 situation, and pretty much I think everyone was caught off the guard. What I would like to know, I mean, you've been involved with DHA for 20 plus years, and you've been in the industry for so long, you understand it inside out. I would like to know, what are the things that worked well, and what are some of the things that didn't work so well when it comes to handling this whole situation from the healthcare perspective in UAE?
Well, to be honest with you, I mean, the whole pandemic matters of COVID-19, it was a shock for the whole world. And what I believe is that what the United Arab Emirates have done, it's a bit unique, because all the countries around the world were making things are very scary, and they had exaggerated a lot of the matters for the publics. So the public were very freaking out to understand what really is happening. However, in the United Arab Emirates, the way that the government has handled it is in a very smoothly ways, where they had assured the public that things are from day one is under control. They have laid out a very good strategy media-wise, which was very important to assure the public that yes, it is a pandemic, yes, there is a virus, but we are able to contain it with certain measures. And learning from different countries and what was happening, and controlling it and trying to accommodate it. It was very, very much important. And I believe the strategy that the government, and even naming it, we had named it differently than the other words. We haven't say it's a virus. We said, no, it's a total campaign that the government is taking to hygiene the whole part of the United Arab Emirates. So even using the wording, they were very conscious in it. And I think this is something that we really admire our government for it. So going back to your questions, I cannot say what was wrong, because this is something was not within our hand to handle it. This is something that affected the whole world. But talking how we went right, I think the whole matter of handling it was right. We have taken the population and the community of the United Arab Emirates gradually through the process. Yes, It was something that freaking out, something that we haven't experienced in our life, but they have been able to take the community toward it gradually and very carefully. Looking at the demographic of United Arab Emirates, we are a community of over 200 nationalities that we live in these countries. So we have to handle each part and segment of these population differently. And this is something that we have really, tackled it. We have seen how the public health sectors of the governments, the police, the Ministry of Health, how they had worked together into different areas of the United Arab Emirates that have a different community living in it, how they handle them differently than the other community. And this is something I think added to the successful journey that the United Arab Emirates is doing and continuing now. Even in opening up and lockdown, we have seen different Emirates has a different timing. And between me and you, even the community of the UAE was wondering what was going on in this Emirates different than the other Emirates. Why we are not like one country living together?
True.
And this is something that we have noticed it by the time that this was the strategy to tackle the pandemic gradually into different areas of the United Arab Emirates according to the different community that lives within that area. And this is a successful part. And even in the opening now in the United Arab Emirates, we have seen that each Emirates is having its own timing and own percentage of opening and going back to work different. And this is actually being successful. And we have seen now most of the Emirates actually is going next to each other and opening gradually is the same.
Yeah. No, I think you're spot on. I have to agree when you said unique. There is not that many countries in the world that are in the position and in a place like UAE. So many cultures, so many nationalities, 7 Emirates. Maintaining and controlling situation in that kind of environment is extremely challenging. UAE was already for the previous 30 plus years on an amazing journey of growth, of innovation, improvement. There is so many verticals in where we're competing to be the leaders in the world. I'm sure that this will also impact, if you're talking about the healthcare sector, this will definitely impact healthcare sector, and I'm sure positively. What do you think would be the changes and how are we going to feel this impact going forward in the healthcare sector when it comes to COVID-19 situation? What can we expect to see?
It has a different impact. If we look, the way I look at it is from the two segments. One of it is from the patient perspective, and one is going to be from the healthcare provider perspective, which I believe the healthcare provider perspectives, they will have a lot of strategies that they have to work on. And their strategies also will depend onto a lot of an elements, which will be their operational excellence, it will be their growth for the future. All of that is going to impact the healthcare providers. And also they have to look into a different segments of healthcare service that they need to flourish their existing services. We can talk about that as we go in the discussion. When it comes from the patient perspectives, which I believe patient will be now more conscious about the safety and hygiene. What has been done or what's been going on now with COVID-19, and if you can see that the government is changing the perspectives of the people more toward a healthy living. So there are a lots of attitudes, a lots of behaviors that's going to impact the people life. And our people at the end, they are our consumers of healthcare. So the consumers of healthcare will be looking totally now different at the healthcare. Before they used just, some of them looks at how these healthcare is being branded, from the infrastructures, from the layout, and from the physician that they have. Now they will be looking more into how these healthcare providers are maintaining safety and hygiene. And would it be safe for them to consume the healthcare? They will look into also other perspective. Do I need to go to the hospital? We have seen something now during this pandemic, that the number of patients going to the hospital has reduced more than 70%. And this is being said by a lot of the healthcare provider CEOs in the United Arab Emirates, and I'm sure also in the other part of the country. So there has been a lot of speculation into the market. So why patients were going? Are they were really sick, or they were just taking the healthcare as a part of their insurance package and utilizing it? So this is the question that, everybody, has been asking. So patients now will be looking into more utilizing of a digital health. This is something that we'll come across in our discussion. So these are the things where I see that there will be an impact from both sides, from the consumer perspectives and also from the healthcare providers' perspective.
No, definitely there, and that's building on top of the discussion is already people, since we're living in this hyper-connected world, our expectations when it comes to any kind of service were on a curve of change, right? Fast paced, especially now after COVID-19. And what I think are like the major new expectations from the patient when it comes to, okay, I need to go to the hospital. What are they expecting to see now in the hospital after COVID-19?
They will be expecting to see some kind of accreditation, certification, evidence that this hospital is COVID-19 safe. Now, I'm not saying by this that I'm encouraging hospitals or promoting certain certification or accreditation, but this is something that the provider has to think of. There are lots of international bodies around the world that has started certification for free COVID-19 hospitals. So hospital now has to do their exercise, because marketing and branding of healthcare to the consumer is very essential. Not everybody is a very highly educated in healthcare. So we have to talk to the different consumers coming from different backgrounds. So what will make them come back to us? We have to assure them that we are COVID-19 safe. We have to keep in mind that we are still having this pandemic is there. We still have the outbreak of COVID-19. So we have to know that how we can convince this patient. Yes, we do have some patients who are COVID-19, but we are still safe for you to come and consume the healthcare within our facility. So we have to look into this, whether we go for certification programs, whether we do market, whether we do an awareness campaign for our hospitals, for our staff, and publish that on our website, on our marketing materials, that we do keep hygiene, we do keep safety measures within hospital to assure them that they are coming in a very safe environment. Yeah,
no, that makes sense. I mean, we're living in Dubai and in Emirates overall. I mean, we're all witnessing there's so many clinics and so many hospitals. And if you go down to Al Wasl Road, you know, I think you can count there is probably a couple of hundreds of thousands of clinics. And there are these now new expectations from the patients. Where does the awareness of all of these clinics and hospitals lays? How aware are they of all of this? How ready are they to change? Because this is not a small change. This will require some, depending obviously of the service provider, but some of them will have to apply some major changes. And especially having that you're managing an advisory firm in healthcare, you're in touch with a lot of them. Are they aware of how big a change is it? Are they ready for it?
To be honest with you, I'm talking from my own perspective. As I do work with the bigger clients, I mean like a bigger providers of a healthcare service within the United Arab Emirates. So most of our bigger providers of healthcare. I mean, those that they have more than a hospital and the clinics within their networks. They are much aware of how they can improve on their services. However, they need a lot of supports to know how they can differentiate their services from what they were doing now before COVID-19 toward how they are going to move to the future. Because there are a lot of change into the existing operation that has to be done. My worry is not about the bigger players. My worry is about medium to the lower players into the healthcare. Those are the ones who has been hit dramatically by the pandemic situation. Those who might close down or might have to merge or might navigate from the existing service into a new services. Those who, if they want to survive into the existing markets, they have to change their strategy of working. And they have to work more into upscaling their standards of healthcare, implementing a lot of measures of safety. We have not to forget one thing. We live in United Arab Emirates where the Federal Health Authority, the local health authority, has actually impacted a very strict regulation when it comes to quality of standards and when it comes to regulation and when it comes to accreditation to improve the healthcare and to ensure that we have a healthy environment and safety for our patients. However, whatever we had in place had never tackled an issue as what we have now, the pandemic situation. So therefore, which I believe now, the federal and local authorities are working onto developing standards that to ensure that those hospitals are more of a safety for this kind of an outbreak that has happened in the country. Here where the provider has to work, if it is not being yet developed or even available for them by the authorities, they need to do their own home exercise. And I know, I don't want to mention names now as not to market those, but I know that internationally, there are a lot of accredited, very well-known international accreditation bodies that has developed a lot of standards and certification into a safety COVID-19 hospital or health facility. And I think the healthcare providers has to work and do their exercise. This is what I do with my existing clients. I help them for that. The other things is that what I'm looking with my client is that to help them to identify where their existing infrastructure are lacking. What I mean by that, there are clients who have a different providers distributed in the different geographical area of the United Arab Emirates. What do we need to do of that? Do we need to have it as of now? Does the existing situation and the financial situation of my clients help them now to still have that large network, or we can combine those different networks and we can reduce and we can contain in our budget spending? So these are one of the things that which I believe is a tip for providers that they have to look into that. When it comes to operational excellences, we have to look at our financial stability, where our supply and where our demands, and we have to look at the different spending that we have, where we can cut our costs. We know that as we increase and as we grow, our manpower grows with it. So do we need that manpower now? We know that we have depends during the COVID-19 in a lot of technology and a lot of platforms. And we have been able to do a great job. Yet we didn't have the face-to-face contact, but still we had contributed to be in touch with our patients. Has reduced a lot on our manpower. So we have to look into that with our operational excellence. And then when we look at emerging to a new opportunities and diversification of our services, here that where we have to evaluate our existing service and look into a new growth. And when I mean the new growth, we look into the new technology, into a new digitalization of our services. And these are few things that I do work with my clients to improve into their existing service with this existing situation that we are in.
Yeah, sounds to me there is so many things that one need to do, and then it's of the most importance to be very smart and careful. How do you prioritize things that you're going to do the first, and then later on, and that is applied to any kind of strategic consultancy that you can provide. I mean, there is, as you said, and that completely makes sense even for me, who is not coming from the industry. With your background, large players usually, and what a lot of people are saying, this whole pandemic and crisis is just going to filter out small and weak, will probably face a very hard time to survive. Large and strong will be even stronger after this. So when you said large hospital groups are probably the first ones who are going to adapt, or what are these small players that have very limited budgets and that, you know, their forecast goes 3 months ahead and that's it. Strategically, when you approach a provider like that, what do you advise as a first step? You know, what's the first thing that I need to do? Okay, I'm facing
for a small providers, you mean?
Yeah. Yes.
Yeah. First of all, we look at their financial, where they are losing the money and where they are making the money. Yes, it is a simple word, but actually it gives you more of how the business is going on. Now, for those who are keen to continue, they will have to put a lot of efforts. Now, maybe it is not financial. Maybe we can save a lot of budget from cutting certain costs that is not for services that not being utilized, and redirect that cost to a new services that can be utilized more. Now, let's look at for example, for people who doesn't understand healthcare a lot. Let's look at, for example, a simple primary healthcare clinic, right? That provide family medicine, let's say, and obs and gynae, for example, of a service, and pediatric. For these kind of a small clinic that provide a family medicine and GP care, they depends a lot on patients coming to their clinic and visiting and consuming healthcare. Let's say they don't have pharmacy. They don't have even radiology. Okay, they have just basic one, just simple X-ray and ultrasound. So what we can do for them, we look at their size. If their size is big, we reduce the size, and we say here by the number of physicians and number of clinics that they run. So instead of having 2 obs and gynae, they can have 1 obs and gynae. Obs and gynae, I mean like gynecology for women health. Okay, if they have 2 pediatricians for the kids, they can have 1. If they have 3 GP, they can have 1 or 2. And then we start with them to work more into digitalization of their healthcare, work more onto the technology, work more onto telehealth. One of the things which we are blessed with, and I've done my research and I've known that, is that in the United Arab Emirates, we do have a very good and strong regulation when it comes to telehealth. So we have telemedicine, we have telediagnosis, we have monitoring, we have mobile health, we have telepharmacy. So why we don't use that? And now it's the time to make the best use of it. The whole concept of medicine, even before COVID-19, we're enforcing what? Home healthcare and day surgery. So most of the successful healthcare organization was a lot focusing on providing health to patients at their home. We have even a home ICU, and this has been implemented even in the United States. So these are the things actually which we now need to encourage more, as we used to say before, and now we have to do it more and more. So these small clinics can work into that. And believe me, now with the concept that a lot of people are still hesitant of going out of the house for unnecessary care, they depend a lot on these different platforms. And I have seen a lot of my friends and families, they communicate with their physician on the mobile app for a consultation. Even the medication now is being delivered to your home. You don't need to go, even in the federal and the local health authorities, they have that facilities of delivering medicine to you at your home's door. So these are the things, it's a small things, but makes a lot of difference for these small clinics.
It makes a huge difference, and for sure, I mean, these two things that you've stated now already make sense. So first is streamline, basically the services that you're providing, try to optimize the staff number, right? And then implement technology. I think there is one misconception, and a lot of people, when you talk about introducing technology to replace people, are afraid that people will lose jobs. It's not really about replacing humans so that you can, you know, cut costs and reduce the number of staff. It's about humans doing what they're supposed to do, things that computers cannot do. And especially when it comes to healthcare, human touch is, you know, you're not really going to believe a robot for an advice that much, as if I have a chance to talk with you over the phone or if I see you. So technology will just allow people to spend more time with people, and that completely makes sense for them. You already kind of told me and gave me a couple of hints on my next question, and you know, obviously we're living in this age of technology, and we're completely every industry is being completely disrupted by technology, and especially when it comes to healthcare, merging technology and healthcare, I think that merger can impact human lives huge. I mean, big time. Save a lot of lives, improve human lives. What can we expect in the coming years when it comes to technology in UAE? You already said that we are pretty advanced, but people are not using that much. And what are some expectations that we can have in the next 3 to 5 years in UAE?
I believe the telemedicine as a whole is going to be changed. Mm-hmm. Keep in mind that we are still not utilizing the telemedicine as it is being utilized abroad, mm-hmm. in Europe and in the United States. We still have restriction to e-prescriptions that has to be done from a physician who is licensed and based in the UAE. So we don't have that e-prescriptions from any consultation that done online internationally. So mm-hmm. I think there will be a lot of maturities toward mm-hmm. the regulation of telemedicine in the coming few years, mm-hmm. if not soon, within few months. So, because I'm sure that the health authorities within the UAE are looking more into that perspectives, because this is something that we have seen. Also keeping in mind that UAE has pursued the medical tourism. So there will be a lot of international patients who are actually wanting to utilize a lot of these platforms internationally. So it's going to open a lot of areas, channels, and directions into that perspective, which hasn't been practicing before. Now, for me, for example, if I will take any consultation from any physician abroad, he will not be able to prescribe any medication for me on e-prescription unless he is available in the UAE and licensed to a facility in here. I think this concept is going to be changed. There will be a lot of rooms open for that. And this is something how it's going to be, the healthcare is going to be driven. So therefore, if our providers, the healthcare providers, does not change their strategy going forwards toward this, I think they will be impacted a lot. Because what we have seen now and what UAE is developing, UAE is developing a strategy is called for Disease X.
Disease X.
And this is Disease X. And this is something that's been announced by the Minister of Health. This strategy is going to help the UAE to deal in the future with any pandemic or virus diseases. Its mean is that the whole country is looking into how they can improve their existing processes and procedure to manage any pandemic that can happen, for God forbid, in the future. And this is something that's great, because that helps also, and even the Minister of Health said, is that the UAE is looking into a lot of developing the technology into the healthcare and digital medicine. So its mean is that we are going forward with a new initiative. So if we do not start from now looking into how we can develop our existing practicing of healthcare, I think this is going to impact us going forward and develop better into the health service that we give to our consumers.
Yeah, no, absolutely. You said telemedicine, AI. You mentioned e-prescription as something as a, what are other, so we have telemedicine as probably the quickest win that we can make, right? What are other missing links in UAE so telemedicine can work? Without talking about talking to a doctor who is in United States. So I'm talking about talking to a doctor from a Cleveland clinic, but I just don't want to go to the hospital, all right? I want to stay home. Is that possible today, fully end-to-end journey, or there are still some missing links that we need to develop?
No, it's available. I mean, the Department of Health Abu Dhabi, they do have their mobile app consultation. The Cleveland Clinic, they do have the Dubai Health Authority, they have a mobile app where all their patient communicates with their physicians for one-to-one consultation, and even for e-prescriptions, and even if they need their medical reports, all of that has been available. So we have a different application. The health authority, they do have, the different health authority, I mean, they do have, even the private hospitals, they have also their app being developed. So what I'm saying is that we need to expand the application that we have. We need to expand the consumer choice, whether it is local or whether it is international. Why? As I said, the United Arab Emirates, it's a country being built into a different people and different segments of population that comes from all over the world, and they live in these countries. We have over 200 nationalities living there. So they have their treating physician might be back home in their own home countries. So this is what we need. We need our regulation to be more matured and developed to host the needs of our people who lives with us in here. So we tackle also their needs. So this cannot happen unless we have more of a mature, developed regulatory standards to tackle that matter too. In-house in the United Arab Emirates, I think what's been happened by the local authorities and by the private providers and the federal government is superb, and it's amazing. But we need to tackle that part too.
Yeah. No.
And
yeah.
No, please go ahead.
Yeah, I have to agree. And I mean, so imagine this. I'm coming from the tech background, and my everyday work is technology, and I'm supposed to know everything that is happening in UAE, and I'm still getting shocked every day when I go to App Store and find out that some department has some kind of an app that I never saw it and I never know it exists, right? So I think there is a lot of work going on, but awareness is not at a really high level that kind of a service exists at all. And then on the other side, I'm sure that a lot of people are not tech savvy enough to use service like that because of a couple of factors. You probably, slightly trust is major factor, right? You don't even trust human, and then I'm supposed to trust it through a mobile app. And I think that, probably where we need to work on is the awareness of all of these services that are available. What do you think about that part, and how well are we doing in educating people about this and spreading awareness about all of these services?
This is actually a very excellent point. I feel we still have a shortage in the awareness. Now, the matter is that it depends how you look at it. for me, I feel is that, yes, it is the role of the providers who have their own application to make an awareness for their clients or for their consumers or put the budget. But I believe national-wise, we need to have an awareness campaign. We have a different health authority has a different application, right?
Yeah.
Not everybody is aware of that unless they start asking how, and this is what has happened. When the pandemic has happened, a lot of people start saying, how would I'm going to see my physician and I have an appointment? And by the way, a lot of appointments being canceled because they didn't want the patients to come to the hospital, especially those are routine cases that they don't need a major interventions. And this is what has happened. So people was panicking how they will get their medicine. So they start calling the call centers. So I believe we had a bit of lacking in the awareness. A general awareness should have been done for the public on how they can get in contact with their physicians, how they can have their medication. This is something that we had lacked in. And this is actually lesson learned because we are learning, because we haven't been through it. So this is one of the things that, yes, we need to have a lot of awareness. And also now going forward, actually, we should encourage the good habits. I believe there is a lot of things we are learning from this pandemic. We've learned that there is not all the visits to the hospital. It should have been necessary, especially for the routine and the follow-up cases. They don't need to do to see their physician. If they've done their lab work is uploaded to their medical records. The physician checks it out. Everything is fine. So they don't need to come. They will prescribe them the medication. The medication will be delivered to their home address, and that's it. So a physician can have more of a quality time for other patients to attend. So there is this habit actually should not be discontinued. And this is which I really eager that the government authorities and even the private hospitals actually should not, encourage the patient again to come back if they don't need to, for especially those routine cases, so they can free up a lot of spaces for patients who are really in need to see the physician. Keep in mind, insurance is still, they are going to pay them. So they should not just overload the hospital with the number of patients just for them to make money, because the insurance will still cover the patient who had consumed the consultation. However, while I was doing my exercise before our talk today, so I was reading, even though I do work in the insurance industry, but this part I was not a bit sure, and I just wanted to make sure about it. And I found we do have a gap actually. And I think this is something that I don't know if the Federal Insurance Authority are looking into it or not. But what I found internationally, that a lot of insurance, they do cover telemedicine within the insurance policy.
Wow.
And I think this is something that we have to look into it in the UAE. If we encourage the insurance industry to cover the telemedicine within the policy, I think this will be of a huge development into the healthcare, into the United Arab Emirates. And we need that, because that can free the hospital a lot to concentrate more on patients who are really needs a healthcare. And actually we can have a lot of quality time between the physician and the patient, and will not encourage the patient just to utilize the hospital just for nothing, for a routine visit.
No, absolutely. No, absolutely. I caught your statement before when you said, okay, hospitals were working under full capacity before, let's say. Pandemic came, all of a sudden, 70% of people are not coming. And then you question yourself, why were they coming in the first place? Is it like 70% of them are not taking care of themselves now anymore? or it's just they were coming just, you know, it's my weekend ride, you know, I got to see my doctor. and I really do believe that if you can optimize the process, introduce telemedicine, introduce technology, insurances step in to cover telemedicine consultancy, you can really leave space for people who are in real need to see their doctors, right? And then I'm sure that the landscape of the service provider across Dubai would also change, because we wouldn't need for so many clinics. Amazing. I think we covered a lot of things, and I think that viewers will probably have a lot of questions. So I encourage everyone to drop a comment below and ask if they have any questions. To round up, I would like you just to summarize one more time, because I'm sure, you know, during this pandemic, okay, patients and everyone is obviously concerned about their health, but I think there is a huge amount of providers who are concerned even more, because it's about existential, you know, it's about their families, and that's their work, you know, and that's they're making for living like that. If you need to summarize in like 1 to 3 top 3 advices for service providers in next, I'm not talking about 3 months from tomorrow, what do they need to do?
My advice usually goes to my clients is that they have to revise their strategy. They have to know exactly where they are and where they are going forwards. They have to have a vision into the future. Are they the one who are the same last year? They want to do the same business, or they are looking into a new venture? There will be a lot of challenge. Will they be in a position to go along with this challenge, regardless of how much it's going to cost them? Because this is very much important for them to understand how much they are ready to invest into a technology. Now, when I speak about technology, I'm not speaking about the medical technology more than the information technology, because this is very essential and very important. Unfortunately, I have seen a lot of providers which they were looking at the information technology as a huge budget and a huge cost, and why we should do it. I mean, we don't need it. We still have our patient coming to us. I mean, why do we have to invest into a lot of that? And then when you look at marketing, they do invest into a lot of marketing, which does not belong to what existing they are providing. So they have to change the whole strategy. They have to invest into the AI, artificial intelligence. They have to invest into their information technology, and they have to invest into awareness for their consumers. This is for them is very important. They have to shift their marketing. The marketing plan and the branding of whatever they do have, it has to be utilized to the best to support what they do have and what they want to achieve for the future. This is for them is important. The last but not the least is that how they can assure their consumers that they are coming to a safe environment. And this is will matter a lot for their consumers.
Thank you, Dr. Laila. Thank you so much. I enjoyed our conversation. I hope that our viewers will like it too. Thank you. Thank you everyone for watching. Please like and subscribe, share, and we'll see you in another episode. Take care. Bye.
Thanks. You too.